So when we talk about the spectrum of prostate cancer, we're looking at two things. One is the Gleason score. The Gleason score is what tells you how aggressive that prostate cancer is. And the second thing you're looking at with regards to spectrum of cancer is volume of cancer. Some patients will have 1 out of 12 cores positive, a very small amount, and other patients will have every single core being positive for cancer. And you have to realize those are different situations. One, there's a small amount. In the other situation, the entire prostate is cancerous. So when you look at the spectrum of cancer, you want to look at these two things. Now, at the lowest end of the spectrum is Gleason 6. This is considered low risk. Now, within this category, there are 3 other categories that involve volume of cancer. So if you're a Gleason 6, next thing you want to look at on your biopsy is how much cancer is present. Is it less than 10% cancer? Is it 10 to 50% cancer? Or is it greater than 50% cancer? Is there a higher amount of cancer there? So, you know, this is the low risk. And next we step into what's called intermediate risk. And these are the Gleason 7s. And Gleason 7 is split up into 2 groups. Gleason 7 has a 3+4, which is called favorable, and 4+3, which is unfavorable. These cancers are typically treated different, and this is usually where the cutoff happens, where patients beyond this 4+3, these patients usually get some form of ADT or androgen deprivation therapy when they have radiation or proton beam or other things like that, when they have this 4+3. Men that have 3+4 are usually not given ADT. So there is a cutoff here with regards to treatment. This is usually a shorter course, whereas when you get into the high-risk cancers, ADT is often used anywhere from 2 to 3 years, depending on someone's specific situation. Again, looking at these cancers of Gleason 7, you're also going to use this same volume, less than 10%, 10 to 50%, or greater than 50%, and that just tells you again how much cancer is present. The last group is high risk, and these are cancers that are Gleason 8, 9, and 10. And again, you're going to use the volume of your biopsy to show how much of this cancer is present. Now, some patients will have 2 different Gleason scores, and so you may have a Gleason 8 and a Gleason 6, and in that situation the higher Gleason score is usually what is used with regards to treatment and looking at getting the right treatment for your cancer. So this is the spectrum of cancer. It goes from low risk, intermediate risk, high risk, and then the volume of cancer, again, less than 10% would be more on that low risk. 10 to 50% will be intermediate, and greater than 50% would be more of a high-risk volume of cancer. And that's for each of these segments. So that spectrum of cancer, everyone has a different spectrum of cancer. Many guys are dealing with low-risk disease that can often be watched. And then other times, men will have high-risk disease. Aggressive cancers, cancers that are likely to be outside of the prostate. And so they're treated differently. So Know your spectrum of disease. It's important early on to know that so that you can speak with your physicians much better and you can have a better understanding of what the right treatment is for you.